Hi, I'm Isabelle Gagnon. I'm a pediatric physical therapist and clinical researcher at the Montreal Children's Hospital, and I'll be speaking to you today as part of the One Voice webinar series number 1, entitled What Are We Doing to Research Concussion in Kids? I'd like to bring to you some of our research on the topic of rehabilitation and treatment after concussion. We know that although many kids with concussions recover well from their first injury, there remains a percentage of them who'll need a bit of extra help. So I'd like to talk to you about a couple of alternatives we've been working on in the last few years that we hope will contribute to our reflection on how to help kids and youth return to the things they love to do. To start with a bit about myself, as I said, I'm a clinical researcher and physical therapist at the Montreal Children's Hospital of the McGill University Health Centre. This institution is a tertiary care trauma center, and within it, we have a very busy interdisciplinary concussion follow-up program or clinic that you'll hear about in the second of the One Voice webinar series. The combined volume of children with concussions presenting at the emergency department and to the clinic represent a living lab of sorts. This lab serves to keep our research grounded in the clinical reality of the kids and their families, also in that of the clinicians seeking to help them. Our research activities are integrated in the trauma program at the Children's, and whether it be from using our clinical database or by means of specific funded projects, we manage to generate knowledge that can be readily implemented in clinical care. As well as being a researcher, I'm also an assistant professor at the School of Physical and Occupational Therapy at McGill here in Montreal. It's there that I can bring the topic of pediatric concussion on the radar of the next generation of healthcare professionals. That way, they can be more aware of both the problems that the children face, but also of the ways to help the kids and their families. To answer the question of what I'm doing to address concussion in kids, I thought of showing you this little picture of my research program. The program targets two main areas. The first one has to do with studying the consequences of concussions. In that, we do things like assess brain structure, brain function, balance, dual tasking, participation in sports, self-efficacy, and other areas to monitor recovery after the concussion and see how that happens. The second area has to do with developing and testing rehabilitation interventions for this population. It's on that second area that I'll focus the rest of my talk. In the last 10 years, we've developed an intervention model based on the evidence that exercising benefits the brain and that exercise leads to improvements in headache symptoms, mood, cognitive abilities in the general population. As you can see in this figure, the model involves three main components plus a home program. The components include aerobic activities, coordination or agility exercises, as well as mental imagery. Those are accompanied by the usual recommendations that are part of standard care. By that we mean things like restraining from participating in high-intensity activities, as well as good sleep, proper hydration, relaxation techniques, and other such recommendations. After developing it, we now needed to see if it worked. We started by publishing a couple of case series showing how post-concussion symptoms that had been present for more than 4 weeks after injury could be decreased significantly in the weeks following initiation of this rehab intervention. Those case series also allowed us to see that the intervention significantly decreased fatigue and improved general quality of life in those kids. It also led to successful return to sports and to school. Those initial promising results led us to design a trial that's currently ongoing involving kids from the Montreal Children's and from McMaster Children's in Hamilton. The kids are recruited between 4 and 12 weeks post-injury, and they're allocated to standard care or to an active rehab group. They're then followed for 6 weeks of intervention to assess recovery, as well as for a full year after that to estimate the risk of re-injury in that first following the concussion. We anticipate results to be out later this fall. The second and more innovative approach to intervention that we're currently testing is the use of a 3-dimensional multiple object tracking training program to stimulate brain plasticity after injury. This work is done with a device called a NeuroTracker. It's a tool that's used to train professional athletes to optimize their dynamic visual attention in the context of their sports. We have evidence that it leads to functional cortical changes in those athletes, and we want to see whether we can use it to treat our kids who have had a concussion longer to recover. A few words about what works and what's perceived as more difficult or challenging in this kind of research. I have to say that what helps us the most would be our integrated approach to research and the fact that we're close to the action, so to speak, in terms of being in the trauma center and having the support of its leadership. But first and foremost, the main facilitator has to be that our research program is the result of ongoing discussion and collaboration between clinicians, researchers, kids, and their parents. Developing and testing interventions would not happen if everyone wasn't on board, try things out, and be open to discovery. Among the challenges is the fact that the population is becoming highly solicited. Kids with concussions attract a lot of attention these days, and many research projects target them. Another challenge is that although we try to involve kids and their families as early as possible in the process, it remains difficult to have them at the research design stage. It's something we strive for. Finally, it can be a challenge to maintain communication and collaboration between all the researchers interested in pediatric concussions. We hope to address some of these challenges with an ongoing initiative linking pediatric concussion researchers through the use of common data elements for our projects. This is work that is promising and will be helpful in linking us in the future. It will allow us, for example, to share data or to design common research projects. So we'll be gathering around a table at the One Voice Symposium, and I really look forward to being inspired. Inspired by new ideas, inspired by others, and by the energy that we'll bring to this event. I look forward to sharing ideas for better uptake of discovery within the clinical programs. I look forward to expand and solidify our collaborative network of pediatric concussion researchers around the needs of the kids and their families. The last Zurich Concussion in Sports Conference in November 2012 started with the phrase, "This is the end of the beginning in concussion research." Of course, they meant adult concussion research. I think we're still in the beginning stages of pediatric concussion research, but that by the end of the One Voice Symposium, we should be well on our way to catch up to our adult counterparts. Intervention and rehabilitation need to be discussed. We need to design trials. We need to advance the field because kids can't wait for us to get our act together any longer. That brings me to the end of my presentation. I thank you for your time, and I can't wait to see you all in June.